Hi everyone, I'm Samantha. I'm a PA here at Fechner MD in Plastic Surgery and Medical Spa. We're super excited to welcome you to tonight's event, the Wellness Upgrade, Energy, Metabolism, Libido, Recovery, and Longevity. Whether this is something you've been thinking about or you're just hearing about it for the first time, this is going to feel like a little bit of a virtual consultation. So if you have any questions, we're going to be doing a live Q&A at the end of it. Stay tuned. I'd love to start with low hormone levels. This is one of the most common conversations I have with patients. Typically, they'll go to the doctors, they'll come in to see me and say that they were told that their labs were normal. But what I want you to know is that normal does not mean optimal. You may feel inflamed, foggy, stuck at a certain weight, but on paper it says everything's fine. Normal is not the same as optimal. Labs are done in a reference range, so what works for you might not work for someone else. If that sounds familiar to you, we're going to talk about it more tonight, so stay tuned. One of the things I'm super passionate about in the wellness space right now is peptide therapy. It's one of the most underutilized tools in wellness medicine right now. They're small chains of amino acids that signal your body to do specific things. So we have peptides like BPC-157, which is amazing for gut health and inflammation. We have MOTS-C, which is amazing for cellular energy and repair. GHK-Cu is going to be awesome for skin quality and collagen formation. And we have a glow stack that combines several of these things. If you've never heard about peptide therapy before, that's exactly why we should be doing a consult. So you can always come in and see me. We can talk more about it. Let's talk about hormone balance. That's including estrogen and testosterone, because for women and men, testosterone matters. Hormone imbalance shows up in many different ways. That may be inability to lose weight, feeling stressed, mood changes, poor libido, poor sleep, low muscle tone, all of the things. Estrogen and testosterone work together to regulate so many systems in our body. So if those are off, you're going to feel it. Hormone replacement therapy is an amazing tool that we have to help support the body systems and how you're feeling overall. Here at Fechner MD, we utilize pellet therapy. So it's a small grain of rice-sized pellets filled with hormones based on what your body needs at the time of your consultation. So we'll create a plan that's exactly tailored to you and what you need. Weight management is one of my favorite topics to talk about with patients. It's super exciting, all of the options that we have nowadays to help patients lose weight, including GLP-1 and GLP-2 therapies. They've changed the conversation in terms of weight management and keeping weight off. They're not about appetite suppression only, they work at a deeper level to reduce your cravings, change how your body processes food, support your metabolism, and help maintain better body composition. It's sustainable. It's not a quick fix. It's not a crash diet. So really exciting, all the changes that we have in this space right now, and it's worth a conversation to have at a consultation. If you're interested in not just feeling better right now, but supporting your aging process in the future, then NAD therapy might be an amazing option for you. It's a coenzyme that is essential for cellular energy production, DNA repair, and resilience at the cellular level. As we age, our NAD levels slowly decline. So supporting your body with NAD as a supplement can be a great way to help proactively keep them elevated. It replenishes these levels, and you may feel better mental clarity, better sleep, faster recovery, and just feeling younger in a really functional way. It's proactive wellness at the end of the day. At Fechner MD, we don't believe in one size fits all. We love a personalized treatment plan here. The best outcomes don't come from a template, for example. Your labs, your lifestyle, your medical history, all of the things that make you you, we want to use that and make a plan that works best for you and can be sustainable for the long term. So if any of this resonates with you, book a consultation and we'll figure out what your body actually needs. All right, so that's our presentation. Thank you so much for being here, joining us to talk about wellness today. We're gonna open up for a live Q&A, so I'll be hanging out for the next 15, 20 minutes. If you have any questions, put them in the questions tab. And another important thing, after the event, check your text. You're gonna be receiving a message from us. Just reply back and we'll take it from there. All right, thank you again for visiting with us. Hi everyone, thanks for joining us for the wellness upgrade. I hope you guys liked the video, and I'm already getting some questions in the chat, so we're just gonna jump right in and start answering them. Someone asks, what's the difference between peptide therapy, hormone replacement therapy, and weight loss, which is such a good question. Peptide therapy, so peptides are small chains of amino acids that, as we talked about in the little clip you just saw, they signal your cells to kind of perform a specific function in the body. So whether that's tissue repair, skin rejuvenation, metabolism support, you're going to get that benefit from it. Whereas hormone replacement therapy, that replaces your bioidentical hormone that's already in your body, but just at a lower level. So it's supplementing what your body is already making. Things like estrogen, progesterone, testosterone, all that kind of stuff. And then weight loss injections, those are pretty self-explanatory. The GLP-1s are going to be a hormone that stimulates GLP in your gut to decrease your appetite. It acts as a suppressant and just helps with fat loss and losing weight overall. And how long does it take for results? The length of results vary. So for peptides, it can take anywhere from 8 to 12 weeks to really notice any results. For weight loss, it's pretty fast for a lot of people. Within the first month, they start to notice decreased appetite and fat loss as well. And for hormone replacement therapy, same. It's very immediate that people start to notice changes in their energy, libido, all that kind of stuff. All right. And are these customized? Yes, all of this is customized. So if you come in for a consult with me, we'll talk about all of the options, what you might be interested in, what might be a better fit for you, depending on where you are in life and what your goals are. We'll talk about it in our consult. All right. And what type of testing do we do before we start hormone replacement therapy? So if we have a consult, before we do any hormone replacement therapy, we always get a full set of labs. I'm going to go through a full intake with you, go over your medical history, go over what your goals are, what you may have done in the past for hormone replacement therapy, and then I'm going to order some labs. You'll either go to Quest and get your labs drawn, and then I'll get the results, or I can draw your labs right during that consult. And then that will kind of dictate what type of hormone we give you and how much of that hormone as well. And then the next question, perfect segue, do we monitor hormone levels after we start treatment? Yes, so 6 to 8 weeks after we do the insertion of the pellet, we'll get another set of labs to kind of see how your body reacts. All right. So many questions. Can I do a combo with NAD and other peptides? Yes, definitely. A lot of people do a combination. And how often do patients get NAD? Someone asked. It really varies. I recommend once weekly, at least for a few months, see how you do on it. But I have patients that do it once a month and it works well for them. Just really depends on what your goals are. And how do weight loss injections work? Benefit of coming to you guys versus buying online? I would say the benefit between coming to me versus just getting from a telehealth provider is that you get that hands-on experience. We do your weights, we talk about your diet, we talk about what's working for you, what's not working for you, your exercise. So it's definitely a more personalized approach. And I can just keep a closer eye on you, which I prefer. And that's pretty much it. It's very easy.
in terms of weight loss injection visits. Will I lose all of my muscle from weight loss shots? It's definitely a risk getting on a weight loss injection if you do not eat a diet high in protein, and you don't lift weights, you don't exercise. There's definitely a concern of sarcopenia, which is why I prefer to have at least weekly consults with most of my patients who are on our weight loss injections, because I want to make sure that you're not dropping your weight too fast. Dropping weight too fast, not eating protein, not lifting weights, those are all going to cause decreased muscle mass and sarcopenia, which just cause more issues down the line. All right. What is the price range for monthly peptides? So the price for peptides really varies depending on how many peptides that you want to be on and what type, because some are a combination, typically ranging between $200 to $400. Everyone who joins on the webinar today is going to get a free consultation with me, and then one person will actually win $250 in beauty bucks that can be used towards your treatment of peptides. But we'll talk about more at the end as well. Is NAD an injection or pill? NAD is an injection. All right. Do the injections hurt? No, I don't think the injections hurt. I'm biased, but a lot of my patients don't even realize that they're getting an injection because I like to talk to my patients when I give it. All right. A lot of NAD supplements, such as True Niagen, how is that different than what's offered here? That's a really good question. There's a lot of supplements in the market. In the research that I've seen, NAD injections are much more bioavailable. NAD is a very large molecule, so a lot of it, if you're taking orally, it cannot get absorbed into the cell, and that's where it does all the action. It works on the ATP in the cell. So if you're taking it orally, it's getting completely dissolves in your gut, and then you don't get any of that benefit. What is healthy nutrition and the role of your presentation? I think healthy nutrition is really person dependent and personal. Healthy nutrition to me is a diet that's balanced, has a lot of healthy fats like avocados, extra virgin olive oil, definitely getting fruits and vegetables in, high protein from lean sources like fish or poultry, including red meat as well, but also having the balance of things that aren't so healthy just for our mental health as well, because that matters. All right. Can you go into more detail on what types of peptides you offer? We offer a few peptides. We have the Glow Stack, which we talked about in the presentation. That's a combination of the GHKU copper that is also going to include the BPC 157 and the TV 500. That one's really good for skin rejuvenation, inflammation, really amazing for our post-surgical patients. We also have BPC 157 alone. We have the copper peptide alone. We have PT 141, which does, it works on libido, and it's actually FDA approved for hyposexual desire disorder. So it can be used for men or women 30 to 60 minutes prior to sexual activity. Works very similar to like a Viagra, but it acts on the hypothalamus versus vasodilating the blood vessels. All right, let's see. What's your favorite treatment? Ooh, I love NAD. NAD, since I started, I really noticed some changes in my sleep. And a lot of my patients also have said the same thing. So I highly recommend that. Do you recommend pellets versus creams for hormones? I think it really depends on the patient. We offer the pellets here because it's convenient for the patient. So as a woman, you only need to get a pellet every 3 to 4 months. And as a male, you only need to get a pellet every 6 to 8 months. That's a lot more convenient for most of our patients versus using a cream weekly, daily, or an injection or patch. So it's really the convenience factor that works for a lot of people. All right. Is there ever a point to stop weight loss injections? Yeah, that's why we follow you. We monitor for too low of a weight. I always check your BMI. I definitely don't want people to be losing too much weight. So it's keeping it healthy and just making sure that our goals are aligned prior to even starting treatment. All right. Is hair loss a side effect of peptides? I hear it is for GLP-1. Yeah, that's a really good question. Hair loss is a side effect of GLP-1 because of usually the speed of weight loss. And just when we lose weight naturally, our hair shifts into more of a cycle of shedding. It does typically come back. But for peptides, no. Actually, they're finding with the copper peptide, it can improve hair loss. All right. What do all the numbers mean after the peptides? You keep saying. That's just the name of the peptide, the scientific name of the peptide. Are there any side effects with the HRT pellets? The most common side effect is going to be a site reaction. They're very well tolerated. Again, these are hormones that are already circulating in our body that we're replacing. So there's really not too many side effects to note. I already answered this question. A lot of people are just asking if they can combine NAD, peptides, and HRT. That's definitely a possibility. Yep, you can combine, and we can, again, talk about all of that in your consult. You do not need to get labs before starting a lot of the peptides as well. We typically keep that just for the HRT patients, but it really depends on the patient. What's the most common peptide? I would say the most common peptide is going to be the glow stack because it's a combination of 3. So you kind of get the benefit of 3 peptides instead of just 1. That's what I like about it. What happens if you stop the peptides? Will the results last? That's hard to say. I actually don't know the answer to that question. I would say that once you stop the peptides, you may notice that you stop the peptides. But with all of them, you cycle on and off for a specific period of time. Like for BPC 157, if you're trying to target, like a ligament repair or having some gut inflammation, we're going to do that for 4 to 6 weeks and then take a break. Because if you're constantly signaling those molecules, you start to downregulate those receptors. So you want to make sure that they're always staying active. Do I need to come to the office for every injection or do I do them at home? So for the weight loss injections, most patients want to come in once a week and just get their injection with me. Sometimes I'll send patients home with one additional week. For the peptides, because a lot of them are 5 injections a week, we'll do the first one together and then I'll send you home with the rest of the injections. So if you're on one that's 5 times weekly, you'll get one on Monday or whatever day, and then you'll get sent home in a refrigerated pack the other 4. And then I would like to see you the following week. This stuff is cool. I know, this stuff is so cool. I love it. It's so interesting to me. I know, science is crazy. All right. So I think we're ready to wrap up. I just want to remind you guys of our specials, which I mentioned before, is that everyone here is going to get a free consultation with me. So that's $150 off. And then one person who joined today is going to get $250 of beauty bucks that can be used towards any treatment. You can make an appointment with me by calling the office, and you're also going to get a text message following the event. Just text back energy, and then you'll be contacted for a consultation. Thank you all for joining. I hope you had as good as a time as I did, and hope to see you soon.